Hello and welcome back to my blog. My name is Sabine. I'm a nutritionist and health coach, and I specialize in fatigue and stress management. Today I would like to talk to you about vitamin D. Are you getting enough vitamin D? Well, technically, vitamin D is not really a vitamin. In its active form, it's actually a hormone. So how do you know you have enough vitamin D in your body? Well, symptoms of deficiency, for example, include mood changes like depression, fatigue, muscle weakness, aches and cramps, and pain in the bones. Or you can get yourself tested, but I get to that. Where do we get vitamin D from? Well, in the UK, the only food source really is oily fish, but the amount of vitamin D in the fish is rather low, and it also depends on how much of it you're really absorbing, etc. Most of the vitamin D comes from exposing our skin to sunshine. But there's a problem when you live in the UK because many of us never really get what they need from the sunshine alone because we just simply don't have enough sunshine in this country, unfortunately, and especially not during the winter months. So what is vitamin D needed for in the body? Well, it's needed for bone health because it's needed for calcium metabolism. It's needed for muscle function. So low levels of vitamin D have been linked with muscle weakness and aches and pains. It's needed for brain health. A lack of vitamin D has been linked with depression and other mood disorders. It is also needed for heart health. It's been shown to actually help lower blood pressure, and a lack of it has been linked with a higher risk of cardiovascular disease. And of course, our immune system needs a lot of it. And doing what we can to strengthen our immune system right now is very important. I want to shout it out into the world that people should check their vitamin D levels. You know, if you or someone you know gets really down in the months when we don't have a lot of sunshine, who doesn't get to go outside, especially between 11 a.m. and 3 p.m., complains about muscle weakness and gets a lot of colds and infections, get them to have their vitamin D levels checked. Vitamin D deficiency is relatively easy fixed. With supplementation. So share this video with as many people as you can. But before you supplement, you need to get yourself tested first. Vitamin D is a fat-soluble vitamin and it can be stored in the body. So how long it can be stored for really depends on the individual, but up to a few weeks it can be stored. So you could cause a toxic level in the body if you don't check what your levels are first. So either check with your GP or order your own vitamin D test via the link I will put in the description of the video. It's not an expensive test and it's definitely worth doing if you suspect you are deficient. So how much you really need to supplement, again, depends on your individual needs and a few factors such as your weight, how quickly you absorb it, how deficient you really are, and if you're on any medication, for example. So this really needs to be discussed with health professionals such as myself. And if you suspect you are deficient in vitamin D, get in touch with me, book yourself a 30-minute free discovery call with me. I can find out more about you and how I can be of help. I'm looking forward to speaking with you. Until then, take good care of yourselves. Bye-bye.